We're from RVNAHealth, which may be better known to you as RVNA, or Ridgefield Visiting Nurse Association, or maybe WNA, if that's what you call that. And just for a little history, 2 years ago we changed our name, and we changed our name to RVNAHealth because we recognized that our current name, Ridgefield Visiting Nurse Association, wasn't accurate. We had grown beyond Ridgefield, we do some other towns. We weren't just nurses, because we also have physical therapists, we have occupational therapists, we have speech therapists, we have personal caregivers, so we have a whole range of healthcare providers. And we also weren't just visiting, we no longer just went to people's homes, we do things in the community, and then people also come to our home on Governor Street, where we have flu shots and clinics, and we also have a fantastic rehab center. So now our name is RVNAHealth. Most people don't call us that, most people still call us RVNA. But, so I'm introducing today, this is Gigi Weiss. She's the Director of Rehabilitation Services at RVNAHealth. And Kate Campbell is our manager of our outpatient rehab services, which is, our services that we do at RVNAHealth and our other places in the community. And they're going to take it from here and go over falls and balance. And not to fall,
Hi, good afternoon. I'm Gigi Weiss. I'm a physical therapist, and I've been with RVNAHealth for 12, 13 years now. So I just, I've been in all practices. I've started in outpatient rehab. I've been in the hospital, and now finishing the last 12 years in home health. And we're, like Nancy said, we have opened our outpatient rehab facility right down the street here at 27 Governor Street, where we do all three disciplines, PT, OT, and speech. And I want to introduce Kate Campbell, who is our practice manager, who's also been in town for a long time.
Oh, yes. I've been in town for a really long time. When I was so young, it wasn't cool to be in Ridgefield. So, yes.
Well, I grew up in Ridgefield. So
yeah,
I'm sorry.
we chose here. So I work at RVNAHealth in the outpatient clinic and out in the community, and we're looking to build and share all of our knowledge and expertise. And we've actually acquired a new satellite office at the Golf Performance Center, where we see not just golfers, but all athletes that need the space and the expertise to do athletic injuries as well. But we are here to talk about falls. We're going to start off with a quiz, see what you already know, see where you need to know, talk about the statistics. I need to scare you a little bit so that we know this is a serious thing. What is balance, the science behind it, to know what your risk factors are and how to reduce them, and then we'll talk. But please, I want this to be interactive. I'm loud, I can hear you, so stop me, raise your hand anytime if you want to chit-chat about something. So, who has had a fall in the past? 2? More? Oh boy. Okay, but not everybody. I see not everybody. But here's, what is a fall? What constitutes a fall? You land on the ground. That's definitely a fall. Actually, the definition is a little bit more strict. Anytime your body comes in contact with an unintended surface, so you get up from the couch and oops, you fall back down, that's a fall. So now if you didn't raise your hand, how many people have had a fall? Yeah, it happens. It happens. It doesn't mean you have to hit the ground, it doesn't mean you have to lose consciousness, it doesn't mean you have to have an injury. Falls happen quite often. Let's talk about some statistics here. What do you think? 1 out of 3 adults age 65 or older fall each year. That's 33% of all Medicare age people fall a year.
Yeah.
True or false?
True.
Totally true. It's not that much. Falls are pretty common, right? Falls are the leading cause of injury death in adults over 65. So think of all the ways you could get injured that would kill you. Is falls number 1?
Yeah.
True. Falls, we don't know which one's going to be the last one. So we don't want which one. Which of the following could you do to reduce your fall risk? Could you remove clutter? Could you talk to your physician about medications? Could you get your vision checked? Would it actually help? Could you start exercising and making you strong and have better balance? Any of those things, all of those things? All of those things, yay! And you're gonna go home with strategies how to do all of them. Okay, moving on. How much, on average, does one fall cost Medicare? You know Medicare cares about money. How much money? Well, on average.
10,000.
Yeah,
Yeah.
it's expensive.
Yeah.
That's why they care so much,
Yeah.
right? Because some falls cost $0 and some lead into brain bleeds and surgery and hospital stays and visiting nurse and rehab and medication, and so call it down the road that can get very, very pricey. Where is the most likely fracture? You break a bone because you fell. Where do you think it is? Hip, hand, or skull? Hip. Everybody breaks their hips. In fact, they're trying to come out with hip protectors that are like airbags. They go, they feel that you're falling. I'm serious. They'll do anything to protect these. Because you know what's another scary statistic? 50% of hip fractures don't make it 2 years.
Yep.
Hip fractures are deadly. Yeah, because sometimes the bone breaks and hits an artery, done, or you just never get back. You never get back to all the walking and your groceries and walking around Founders Hall. And then that leads to other issues. Hip fractures, no good. How often should you get your eyes checked? At least once a year. That's it. That's not too bad. That's doable. As long as you do it. Yeah, I'm ready to get an appointment. What percentage of falls in the home are because of some environmental hazard? Because of the throw rug, or the clutter, or the cat? It's actually about a third. It's actually more like a third. But still, a third of falls that are totally preventable, right? Great, let's just reduce your risk that much. True or false? 2/3 of you who fall will fall again. Absolutely. That's how I know a faller, because you already had one. Falls are serious. I want you to know the sequela and the consequences so that we know it is important to do something, to take some action, to do something about it. And just by being here and receiving all of this knowledge and implementing these strategies, you're already ahead of the curve, well on your way to preventing some falls. We mentioned just some statistics here that there are leading causes of death in our population. Heart disease, cancer are the ones that we think of, but sometimes there are unintentional injuries like car accidents, but falls top that in terms of deaths.
How about stairs?
So stairs could be another environmental hazard. Yeah. You know, it's funny, when my parents moved, they said, I'm gonna downsize and we're gonna get rid of the stairs. And then they come visit me and they're like, oh, these stairs are so hard. Well, because they're not doing it. It is absolutely true. If you don't use it, you lose it. Absolutely. So from a physical therapist perspective, I want to make your life a little hard. I want you to have to work every day because that's going to keep you strong and that's going to keep you moving. If I make your life too easy, then all of a sudden you go visit someone's house and they have stairs. You're like, oh, I can't do this anymore. Man, this is really tough. But if you do it every day, when would you lose it? Right? So think about it. But stairs could be safe with the right strength, the right range of motion, and the right balance.
Come visit me, I have 4 flights of stairs.
Oh my goodness, that's why you're in such good shape. 4 flights. Oh boy. Okay. Every second, there's an older adult that falls. That's how often these things happen. 95% of hip fractures are because of falls. And it's just because that hip is just sitting there, ready to get hit, ready to get force and fracture. Falls are the leading cause of traumatic brain injuries because you're hitting your head, and our brain is just another organ that could be damaged. Non-fatal falls. So we were talking about how scary falls can be very death related, but non-fatal still costs Medicare $29 billion a year, just last year. And that's 2020. That means everyone was home because of COVID. And it still cost us that much money. So falls happen inside more often than they happen outside. $12 billion is paid by private or out-of-pocket payers. Falls result in more than 2.8 million injuries among seniors in the emergency room. All right, are we scared? Good. Let's move on. Everyone says, oh, it's okay if I only fall once or twice. I'm older, I get a pass. On average, what is normal? For how many falls should you have, let's say, in a year? What's acceptable? If you went to the doctor and said, oh, I only fall twice a year, what would he or she say? 0! Trick question! No falls, not normal. Any fall means we need an intervention to do something about it. So saying, oh, I'm getting older, and my fall risk is more, it's okay if I fall. No, absolutely not acceptable. We need to do something about it. But maybe there are some correlations. For example, as we age, we have more prevalence of other diseases like heart, lung, diabetes. These things may come with medication as their treatment. Often medication may have a side effect that increases fall risk, whether it makes you dizzy, whether it impacts how you regulate your blood pressure. You ever you stand up and you get a little lightheaded? Sometimes that's so aggressive that you can almost black out, not see, and then trip and fall. There's anxiety and depression syndromes that need certain medication. They tend to come with fall risk. As we get older, maybe need help sleeping. Sleep medications have these side effects. And that's why it's so important to have a conversation with your physician. Do I really need all these? And sometimes they're very good at saying, nope, this one's good, and this one's good, and this one's good. You're great. And then your pharmacist says, yeah, but A plus C is not good together. Or the combination of these. So we'll talk about that a little bit more. As we age, we have the potential of getting weaker. If you just keep doing the same thing, only 4 flights of stairs every day, but your body's used to it, we will decline. But it is reversible. Exercise, strength training, the right kind of forces that push your body a little bit, you can overcome some of that. But on average, we are losing 30% of our muscle power every decade. And guess what? I already started. It's out of 30. How sad. Strength and endurance goes down 10% for every decade. It doesn't mean we should accept it and give up. It means we just have to work that much harder to make and maintain our muscles. That's for sure. That's my job, to get everybody moving. As we learn more about falls, maybe we're afraid of falling. And there's a strong correlation with if you are afraid to fall, you are likely to fall. But how do I get you to not be afraid of falling? What do you think? What would I do as a therapist?
Pay attention to what you're telling us.
Yes, I would hope so.
Practice.
Practice. And guess what? Practice difficult situations. Practice uncomfortable situations, but safely. So I tell my patients, hey, we're going to stand on one leg. Oh, I can't do that. I need to hold on. I'd rather say you have to let go. You have to. I'd rather you let go and catch yourself and learn how to catch yourself. But actually, to make balance better, you have to be more unsuccessful at it than successful. If it's easy, your body's not learning how to do anything new. It's a little bit of trial and error. Good. Any questions so far? So we know why falls are important, how we might have some increased risk. This is globally, this is everybody. Now let's find out about you. So, hands are free. Everybody's got your hands free. You're going to put a finger up anytime this applies to you. If you've had a fall in the past year, give yourself a point. If you have used or someone has told you you need a cane or you need a walker, give yourself a point. If sometimes you're unsteady when you get walking, give it a point. If sometimes you like to just hold on to the dresser or find the bedpost or the back of the couch, I call this furniture surfing. As you're surfing around the furniture, give yourself a point. If you are worried about falling, another point. If you must push up with your hands to get out of this standard chair, give yourself a point. If sometimes you have trouble going up on a curb, and you say, oh, can you just hold on there, let me get a little balance, or you need that cane to get up, give yourself a point. If you have to rush to the toilet, give yourself a point. If you don't have full feeling in your feet or toes, we call this neuropathy, maybe from diabetes or other issues, give yourself a point. If you take medications that say there are potential side effects of lightheadedness, dizziness, tiredness, give yourself a point. If you take medications that help with your sleep or help with anxiety or depression, your mood, give a point. And lastly, if you feel sad or depressed, give yourself a point. All right, hopefully we're on one hand, maybe two, definitely not more than two hands, right? You didn't need your toes to count. If you have 4 or more, you are a higher risk of falls. 4 or more. In fact, you see the big jump between 3 and 4? That's why 4 is our cutoff. But look at how much it grows if you had 5. No good. But even if you had 3, that's a 32%. It's something we should still be working on. So hopefully you're in this range, and with this, we're going to lower some of those things. Here's another question. Think about who falls. There's a high-functioning person. I'm going to say it's me. And I am texting, and I'm in my high heels, and there's a curb. Oh, wait, I got to carry everything from the car. Come on, baby. And the groceries. Come on, let's go. Oh, there's stairs. I can do it. I might be doing some stupid things. Very, really not safe. But I'm high function. Medium. This is someone that maybe uses a cane. I can do the stairs. That's fine. I don't do them all the time, but it's okay. I'll just be a little slow. I'll catch up with you. But they're safe, totally safe, and they like to play it safe. And then there's lower function. They're sitting in a chair. They get help when they need to go to the toilet. They get help when they need to go to the car. They don't have to stand up and cook. They are served and they walk to the table. That's the lower function. Who falls the most? High, medium, or low?
High.
High. You're doing crazy things. Yeah, what do you think?
I'm going to be 86, okay?
Really?
Yeah. So I do things slower than I used to.
So
That
would you put
prevents
yourself?
me from falling most of the time.
Yes, so you're in the
Really
medium
have
category,
to.
being
Can't
safe.
move the same way you did 10 years ago.
Yes.
Even 5 years ago.
Sure.
Cannot.
You are moving at your maximum capacity,
Right.
safely. You had a higher capacity, so you're at a medium capacity. Anyone say lower would fall more because they're so low level? It's possible that when they get up, their risk of falling, but in terms of like hours per day or how many falls per year, it's significantly less because they're in the chair. They're playing it really, really safe.
That brings me to a point.
Yeah.
As we get older, and we get a little bigger and a little slower, and we're more careful, we do less. And in doing less, we can't do what we should be
Oh
doing.
my goodness, I
Where do
can't
you
even
live?
move the slide because that was the answer. That's exactly right.
Could you repeat the comment?
Okay, I'll summarize it. So, who falls? We can make a case for any of them, but according to the research, the medium people fall the most because they are not fully capable. They're playing it safe. They're keeping it slow, but they're never challenging themselves. So the best they can do is stay the same. And then they age. And then they age. And then if you're higher level and you keep challenging yourself like a little kid, oh, there's a curve, let's play balance beam. If you keep challenging your body, it stays good, it stays high level, it stays up there. Those are the people that don't fall. They fall the least. So if you feel that you're medium function, fine, I want you to be safe. But we do want to get you into a higher function so that you could do some of these things if presented. We'll learn more about balance, but it's not about having perfect balance all the time. It's about being in control. Recognizing, oh, I just stepped on a rock, I might be a little sideways, and recovering quickly before it turns into something. So you hit it right on the head. We slow down, but then we go from that high to medium category, and it actually raises our risk. So I could stop everyone from falling. I give you a wheelchair. If you're sitting, but that's not life. That's not how we move. That's not how we function. If you're going to stay upright in this world, I want you in the high functioning category. Fair? Let's do it. Step 1 of taking control. Get a checkup. Make sure you see your doctor now that they're open and COVID's a little bit more under control. Talk to them about, I think I'm at risk for falls. What can we do about it? How do you feel about it? Make sure you go through the medications, and sometimes it's really good for the primary care to understand he or she is like your team lead. They are the ones that should be communicating to the cardiologist and urologist and oncologist and every pulmonologist. Everybody should be talking through that primary care who knows you best and helps make decisions. But also, they did amazing in organic chemistry. You know who did better? The pharmacists. They are now PhDs and doctors of pharmacy, and they are wicked smart at their chemistry. I would go to your pharmacist and say, here's my list, you have it. What do you think I really need? Where are some potential interactions? What can I do to bring up? One of the things we do at RVNA when we go to someone's house, we take in all of their medications, and we have a formula, a software that looks for potential interactions. And we send it to the primary care to say, hey, did you know that there's an interaction with this medicine? Because often they go to the hospital, they come home with something new, and the primary care doesn't know it. So we try to catch those things earlier before it could turn into something like that. Discuss with the physician supplements to help bone growth, muscle growth, nerve health. Make sure you take care of your feet. I'll show you something next. Healthy eating. That's one of the risk factors if you're not eating 3 good balanced meals a day. And we also want to just keep the right amount of sugar in our bloodstream to keep us awake and active and functioning and limit any disease and fatigue. Water, hydration with electrolytes is part of that as well. And get your eyes checked every year. Get the prescription updated. Wear the glasses that are prescribed and clean them. Shoes. Wear something supportive. Slippers are best for slipping. They aren't grippy necessarily. They slide off your feet. You can trip over them. So if you are someone that kicks off your shoes and changes right away, make sure it's not just your socks. Put on a house shoe, and we're looking for something with a good sole. There's plenty of cute options out there. And then something non-skid also with good support when you're going outside. If you have a cane or a walker, make sure you're using it properly. And you may say, oh, I have to see a physical therapist for this. Can I tell you it's not rocket science? Here's the method. You stand up tall, and you put the cane here, and the cane height should come to the little knob on your wrist. And the reason for that is usually our arm length, it allows for a little elbow bend. If you were in a pool and you had to push yourself up, if it's really high, it's hard, and if it's really low, it's hard. There's like a perfect angle, and that's that angle, okay? So that's the reason for this height. Some people think, oh, well, she's really bent over. Let's lift the walker higher. No, I want you to be able to push higher and use your muscles to bring yourself up into good posture. Does that make sense? Great. Now everybody's going to walk out here with the right height.
And we'll do adjustments if
We
you
can
guys
check
have
it, too.
any canes or walkers. If you want us to look at them, we can absolutely do that.
Rushing increases your risk for falling. Why would you rush? What in your day? I'll tell you, I have funny, but what makes you rush?
Because we're women, you're really cold.
That's true. Tell me about it. You don't rush? The phone is ringing, and you go, I got 10 rings before it hits voicemail. That's you? Okay, I don't. Like, I don't want to deal with a voicemail. I have to call them back. Where's the phone? Let's go. What's another instance that you might rush? Bathroom. Ding, ding, ding. And that's why on the questionnaire, if you have urinary frequency or incontinence, then you are more likely to fall, because if you get that urge and you rush to go, chances of that. So take your time. Balance. This is the queen. I love this picture. Yes, with the queen wave, right?
No.
So she has amazing balance, and I can tell from this picture. Let me tell you why. Here she is looking at the camera, not where she's walking, going down the stairs while carrying a pocketbook and doing a wave. This is so good, right? That's what balance is. Balance doesn't mean having to stay perfectly still. It's able to control it no matter what the environment gives you and adjusting to it. It's the ability for your body to stay upright. Balance isn't just thinking feet and balance. It's an integration of the brain, and the brain has to make decisions given different input. I'm going to get a little sciencey here, and then if I see the eyes start to go, then we'll change the topic and you're going to get moving. But I want you to understand how complex. You don't need to understand this. Just appreciate how complex balance is. So our brain takes sensation and different information and makes a decision. For example, from our eyes. Our eyes tell us, you must be upright, because I can see heads that are level. I must be falling back, because that's the ceiling, or I must be falling forward. So the brain says, aha, my eyes are telling me something, I need to adapt. Another one is sensation from the feet. I'm on my left foot. I'm on my right foot. I'm about to roll my ankle, I should do something about it. I'm on my toes, I might have to take a step. So we're using sensation from our feet, our skin, our joints, our knees, our hips, our spine, and creating and problem solving from that. The last one is the vestibular system. And it's a fancy word for the balance center, which is part inner ear. We have fluid, you've heard of anyone have vertigo with the ear rocks? Yes, yes. So there's some crystals that have a different weight, and there's fluid that has a weight. And if you think of like a scale and an equilibrium, that sensation, that movement sends signals to the brain, and we make a decision. And we can tell forward, back, left, right, rotation. Think about this. You're in an elevator. You know it's going to go somewhere, but you don't know if it's going to go up or down. Your world didn't change because the doors are closed, so your eyes aren't giving you information. Your sensation, you're still feeling the floor. That doesn't change. How do you know if you're going up or down? You sense it. Your brain made a decision based on how the fluid got compressed because the elevator went up, or it went up because the elevator went down. Your brain made a decision after that, and you were able to tell. It's quite amazing. I love treating balance here. So the brain takes all this information and makes a decision about not only should my body react, but how should my eyes react. So if you're walking down, you should be able to look left and right. You should be able to focus and move your head at the same time. My head goes one way, my eyes go another, and that's a very special reflex. And that's coming from the balance center. That's part of our balance assessment. It's not just how well do you do. Oh, you stink at balancing on one foot, you should do that. We as physical and occupational therapists figure out, well, why are you not good at it? What part of the puzzle is not working for you? Let's work on that specifically. Okay? Questions there? It's way too quiet. We gotta get the people up. Okay. Yes?
I understand that sometimes the fluid gets somewhat crystallized.
So there is fluid and there are crystals.
Okay.
In the very fast version, the fluid stays in its role and the crystals stay in their place, but sometimes with age, sometimes with medication, sometimes with dehydration, sometimes with a fall, a crystal will go out of place. And the brain knows what fluid feels like. What if there was a boulder in the pool of water? It doesn't know there's a boulder there. So that feeling is like, oh, I must be on a roller coaster. And then the eyes say, if I'm on a roller coaster, I gotta move my eyes. And that becomes vertigo. Yes, it's fascinating. As therapists, we have techniques to figure out where the crystal went and how to put it back in place. It is, if done correctly, 80% effective in one treatment. Those are the ones that make me look good.
She's very good.
Yes. Yes, another question.
I have a comment about the elevator is the Luxor Hotel, which is in the shape of a pyramid.
Yes.
And the first time you get in the elevator, you expect to feel it going up or down. It goes diagonally.
It goes laterally.
And it is the strangest sensation.
Wow.
You don't know what to do.
Yes, so we talked a little bit about use it or lose it. You've never used that lateral and upward force before, so your brain didn't know. Think about kids that are on swings, or the carousel, or roller coaster. Their vestibular system is so used to getting knocked around and upside down and topsy-turvy that they're no problem. But what if you did that? Whoa, right? If you don't use it, you lose it. But I bet those employees that work at the Luxor, totally used to it. Fascinating, yeah.
Why is the vestibular situation affected by how much you're drinking?
So the alcohol.
No, I meant water.
Yes, yes. Can you tell where my mind is? I know. So yes. So because there's fluid, and the fluid's not perfect water. We'll call it fluid because it's got some stuff in there. And if you take away the water content, it becomes more viscous. It becomes thicker. So if the brain is used to the water whooshing around, and now all of a sudden it's molasses, it's sending different signals and causing more reaction as if you were actually falling, as if there was actually some spinning. So yeah, so dehydration, and also, you know, those crystals, they need some hydration as well, and when you're dehydrated, the risk of them breaking off and moving into the wrong position, into a canal, is more. So hydration is part of your decreased fall risk strategy.
Now you tell me, I cut down on the water because I made too many trips to the bathroom. I needed
know.
roller skates.
And that's so common.
It's so
Yeah.
common.
It's so common.
I gotta tell you that peeing is healthy. You have to do it. Don't try to do it less. It's your body's way of getting rid of what it needs. You take in the water, it will get rid of what it needs. But it is more healthy to be dehydrated and have to go than to be dehydrated and not go. Love the discussion points, but we gotta get moving. So everybody pick up your balance assessment. You should have
Does
gotten
everyone
one.
have one of those sheets that looks like?
It looks like this. It looks like this.
Yep, the balance test, it's a front and back. Here it is. Yeah, it's a front back. Getting it.
Getting graded on this.
We are. I hope you have a
It looks
pen.
like this, okay?
Okay. Now that I've shown you, you might want to put it to the side. Clear your
We'll put it right on the
space.
floor for a little bit.
Everybody just stand up. Let's stretch to the sides. Yes, make sure you have room to stand. Perfect. Put it on the ground as long as you can pick it up. Can you sit down but without using your hands? Beautiful. Can you stand up without using your hands? Fantastic. If you cannot continue by using your hands, just make a mental note and everybody down. Oh, I have such control. Here's the game. Go ahead, sit back down. Here's the game. You are going to stand up, sit down, stand up, sit down, stand up, sit down as many times as possible in 30 seconds, safety first. Does anyone need help or a hand around?
I have a question.
Yes,
I have a bad throat, okay?
yes.
So when, that just happened to me when I had to stand up. I can't do it without
Either do it with holding on or skip this until the foot feels better, but I don't
So
want
it's
to
not
make
like
it worse.
there's something.
No, yeah,
Don't
I
find it
understand.
pain or anything, don't do it or yeah.
It's not, it's,
If this is part of your homework, you're gonna get it done. If it hasn't been assigned to you by your therapist, then hold off for now. But you'll get it in therapy, I hope. That's for sure. What's that?
I finished the therapy.
The home therapy. Then you should be going to therapy. There's always more.
Had that twice before.
Good. Don't overdo it. Do whatever you're comfortable with hands, without hands. Are you ready?
So this is just an assessment, just to give us, give you and us a general
And
guideline, so.
keep count of how many you do. We're not gonna go at the same pace.
Yeah, everyone's gonna go.
I'll
at
do
a
it with my
different
air chair. On your mark, get set, go. Up and down. Keep counting. There we go. All the way up, all the way down. All the way up, all the way down.
pace. We're on 10 seconds.
Oh boy, 20 to go.
All right, counting
Faster,
ahead.
Mike.
How many you can do? If you
Come on.
can't, then stop.
All the way up, all the way down. Got
20
it.
seconds. All
Cover.
right, we got 10.
Keep it up, keep it up. Oh, I hope you're breathing hard.
And stop.
Done. Woo! Good job. That was nice. The knees gave out. That's something we have to work on. Okay, so look at your sheet. Write down your number and maybe the date so you have a baseline. And let's see. Over here on the sheet, it's going to give you a goal, an average. Average scores with age 60, 65, 70, 75, 80, 85, 90. If you are more than 14 in whatever category, you are amazing. Good job. If you needed your hands, technically you're a 0. Yeah. Okay, so circle where you are. Do you have the stamina of an 85, 90-year-old? Should you be 60 and you can Benjamin Button yourself and go? Okay. Why this one shows us fall risk is its strength and muscle stamina. Who cares if you could do this once? Who cares if you could walk 10 feet? Because Stop and Shop is a lot bigger. And you have to have the same good balance at the end of your shopping run as in the beginning. Or you're going to the mall and you're getting all the Christmas shopping done at once. That's a lot of walking. You have to have the same good balance at the beginning and the end. So this is how we test muscle strength. Even though it's not one of those 3, vestibular, vision, or sensation, those who are weaker fall more. There's a very strong correlation to increase someone's strength, decrease their fall risk. And this is showing if strength is something that you personally need to work on.
How do we make it better?
Good question. 2 slides. You're gonna get it. Now let's do a little bit more challenge on the vestibular and the sensation system. So come stand up again. Can you put your feet together? Here we go.
Stand up.
And stay here. Ready? Get them together. Get them together. Hold it. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Take a break. Can you put your feet like arch into your toes? Can you fit them together like a puzzle piece? Here we
Not
go.
quite heel to toe, like a 3/4.
If you fall, if you can't, then you sit down and you mark your level. You mark what you were able to do. 3, 2, 1, switch feet. You have to be able to do it on both feet.
Oh,
Here we go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Another step forward. Heel to toe. Make your shoes kiss.
Heel to toe. If you feel like you need to hold on.
Yes, the moment you're off, you sit back down. You mark it that that's as far
Then
as
you're
I'm
out.
willing to
Then you're out
go.
if you have to.
7, 6, 5, 4, 3,
That's okay.
2,
You're out.
1. Good. Try and make sure that heel and toe, other side, heel to toe. Make them touch. Make your shoes touch. There you go. 10. What do you notice in your body that's moving? Ankles. Good thing. If your ankles are stiff, your hips go. Because your knees don't go sideways, but those hips sure do. Good, take a break. We've noticed that, research has noticed, that those who are younger use their ankles better than those who are older. And those who use their ankles fall less, and those who use their hips fall more. So when you do these balance exercises, let your ankle move. Train it to move. If your ankle could do all the work, then your body doesn't have to do all the work to compensate. Let your ankle move. Last one. Stand on one foot. Here we go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Switch it. Do I get extra points for a stiletto heel? Here we go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good job. If you had to hold on, you did not pass that level. If you only got 2, 3, 4 seconds, write it down. So everybody have a seat, get your form, and write down what level you were able to pass. And if you didn't pass, maybe how many seconds you were able to do. This is your baseline. And I hope that with the exercises we give you, you practice them, you get better, you check yourself in a month, and I want to see progress. Guess what? In 2 weeks, it should start to improve. That's not long. In 4 weeks, it should really improve. That's the power of exercise. That's the power of exposure, doing something challenging. Yes?
I noticed I was much worse on one side.
Yes. You're going to count the worst side. Because you can't just say, forget left leg, I'll do 2 rights. Sorry, you're only as good as your weakest link.
But why is that?
Why is that? That's what therapy's for. Maybe there's an injury, a compensation, a weakness, a nerve thing, a brain thing. We got to figure out why. Could be a dominance thing, a vestibular thing.
In your packets, there's a sheet that says information on the top. These are some of the exercises, and it kind of describes what we just did. So the ones that you had difficulty on is the straight leg raise. If you can't, or the single leg stance, if you can't do that, then there's a variation where you kind of bring your leg out to the side. So those things that you can work up to. And there are these pictures here, and then the tandem standing and the tandem walking. We always want you to do that with a counter or a couch or something there so that you have support. And then, of course, the sit to stand is everyone's favorite. And a nice firm chair. Don't try this on a couch. You want to get a nice dining room chair, something like these chairs are perfect. Yeah, something that doesn't slide. And sit to stand is really good.
It was like this. Is that the most challenging?
Correct. Okay. Because you don't have your hands to help you with any forward momentum. So yes, technically the test is arms crossed and
And
the
when I
hard.
do it in exercise, when I hold them out, so I should try
Yes.
that.
So sometimes in exercise we practice with the arms out because it helps us counterbalance to really get that butt back. And here it's harder for me to do that. I want to drift forward, which is not really great for the knees. So yes, sometimes we'll do it like that or hold a weight. But for the sake of this test and balance, you should be able to do it. You could also do both. They're different. So pointing out, everything we just did here in a test is now becoming an exercise. And it's your job as attendees of the Ridgefield Library lecture to go and figure out if you can do this on your own. Most of you can. Say, oh, this is easy. Let me make it harder. I'll try to swing my foot. I'll close my eyes. If this one's hard enough, anytime you close your eyes, we just took away 1/3 of your balance systems. So the brain is working extra hard, listening for the vestibular and listening for sensation. Stand on a pillow. Then you don't have really good sensation. We're really challenging the vision and the vestibular. So this is plenty. Give yourself 2 weeks, 3, 4 weeks, check yourself again. You should improve. I believe so strongly in the power of exercise. If you can't do it, if it's not safe, come to us and we will figure out, well, why is it not? What is the right level? We got to get you to use it. We don't want you to lose it, but safety first, right? So give this a good go and then let us know if this is. Yes, it is. And also, if you think, I can pass this, this is nothing. Oh, trust me, I can find more exercises for you to challenge you, right? It would be my pleasure. Yes? Oh, I'm sorry, Nancy, can you help me? I can't hear her.
Do you need an exercise? It's just on the sheet.
Okay,
Oh,
great.
sheet?
I have one too. There you go. Okay, so we're back to take control. One was go talk to the physician. No, Number 2, take a test. Check. Number 3, get your body moving. How much should we do? So according to the American Medical Association, adults should work out, exercise at moderate intensity for 150 minutes a week. It boils down to about 30 minutes 5 days a week or 20 minutes 7 days a week. And moderate intensity is not super comfortable. It means that you're going to have to take a breath every few words or a sentence because you're so out of breath. If you can just talk on and on and on and on and on as you're taking your walk, it's not strenuous enough, and that 30 minutes isn't enough. It needs to be more. Vigorous, then you need even less. Vigorous is you're really working hard, you're really breaking the sweat. So that's for the regular adult. What do you think minutes per week wise do you need if you are 65 and older? Let's just go higher, lower, or the same. What do you think? Higher, because you got to work harder at it. Anyone say lower? We need a break. It's actually the same. Yeah, it's the same. You don't have to work harder, but you got to do the 150 minutes a week. This is an interesting one. Fortunately, you're all here not in an assisted living, but they started to measure, well, how much do residents in assisted living facilities get of moderate intensity? And it's about 42 seconds a day. What do you think we all do every day that's 42 seconds worth of moderate intensity exercise?
Open the refrigerator.
It happens in the bathroom. It's on the toilet. That's sometimes work, right? That's it. They're not moving their bodies. We got to get them going. No wonder it gets worse and worse and worse, right? They're only getting 42 seconds a day. It's just not enough. She just got it.
We're cheating.
Okay.
Just hit me.
So exercise works. Exercise helps keep you healthy. We can just talk another lecture on the benefits of exercise. But in terms of fall risk, we know that being stronger and practicing these balance situations make you better. So what should you do? Whatever you like. Whatever you're willing to do. It is important to me that you actually do it. It needs to make you happy. You need to stick to it. It should be on your own, or it could be in a group. I am a physical therapist, and my husband's here to attest that I don't get to exercise unless I have an appointment with a buddy to go out and do it, because there's always something else to do, like sleep, paperwork, watch TV. So if that's what it takes, get a buddy to do a walking program. Try and incorporate balance situations. Tai Chi is a wonderful example. Thinking about strengthening the legs, thigh muscles, ankle, because we just saw how much the ankle really works, and also the core. We should have some abs and core work in there. It needs to be at regular intervals. I really want you doing at least 2-3 days a week. 2 days a week, men can gain strength, women can't. We need 3 days a week. It's just not fair. It's because they have more testosterone than us. It should be simple, it should be cheap, and it should just be willing to do. That is, if someone said, what's the best exercise? I just want you to pick something you like that's more important to me. Walking. There was a question. Did you still have it? Yes.
Yeah, what about these water exercise programs?
That's a really good question. Again, their exercise, I'm in favor. There is a lot of core work going on in the water, but it's just a little different balance. Some are good, some are more challenging. Positions in the water, when the water's moving and you're on one foot, it's actually harder, or walking tandem. But because we live in a world outside of the water, I think it's important to do both in terms of balance stuff. But yes, water aerobics is absolutely fantastic. So a walking program is a great place to start. In fact, there's a lot of surgeons back in the day, they didn't send hip surgery, hip replacements to therapy. They just said, here, just walk it off. Go for a walk. Because walking does everything. Walking is balance. I go from one foot to the other foot to the other foot. Walking is endurance. I'm working my heart and my lungs. It's muscle stamina. I have to walk for a long time. It's getting my hips moving and stretching. It's contracting all the right muscles. It's fabulous. So go for a walk. But why?
How does walking 20 minutes or half an hour a day compare to these other exercises?
Very good, but a little different. So walking is going to help you with walking. It will maintain your balance. It'll maintain the strength that you're using.
You have to do both? I do an exercise.
I mean, you're asking a physical therapist. Yes, we should.
I do exercise at
And
home
you don't have to
anyway.
do something, as long as you're doing
With
something
the
every
Zoom.
day, you know?
Yeah,
if you-
that's good.
So you don't have to walk and do all these exercises every day, but maybe one day's a walking day, the next day could be your exercise day, so split it
Yeah,
up
I
that way.
just wondered how it compares to that.
Yeah,
Because
that's a
I like
good
to
question.
walk.
Not everyone wants to do these balance things. How about incorporate it into your day? Just expose your body to a little balance challenge. Every time you brush your teeth, do it on one foot. If something's in the microwave, you have to hit the buttons while you're heel to toe. Somehow work it into your day. Whenever you're in that chair, you get up with no hands. Every time you're in that chair, you do it 10 times in a row. So if you work it into your day, then you're exposing your body to it, but it's not a nuisance. It's not like you have to put it on your calendar.
It's interesting how it works though. If you don't do it, that you feel like you've really missed something when you get into that routine. I
Exercise,
realize it's very important.
exercise is medicine.
Yeah.
We prescribe exercise according to what you need. And I can give you the most perfect medication and the perfect exercise prescription. I'm sorry, it's just a big pill. You gotta swallow the pill to have the benefit, right? I can give you exercises. If you don't do it, you don't get the benefit. So, but our job as therapists is to help you implement it into your life, not just say, here's a big program, good luck. We want to work with you and do that. So let's go back to walking. Walking is important. And I hear all the time, oh, Mom, slow down. You're going too fast. I don't want you to fall. But actually, a little faster is better. So they started, you've heard of vital signs. Can you name some vital signs? Heart rate, blood pressure, oxygen,
Pulse,
yep, heart rate.
everything.
Yeah, so those kinds of things can tell us, yes, your body is alive and doing well. Temperature. So, walking, your speed of walking, gait speed, is considered the 6th vital sign because it's an indicator of how healthy you are and how your body is. And they found that those who walk faster are more likely to be independent in all of their activities during the day. They're less likely to be hospitalized if they fell. They're less likely to fall. And they're more likely to go straight home after being in the hospital. In fact, you have to walk quite fast to get across a New York City street without a taxi. Those who walk slower need help with their life, are more likely to go to the hospital, need intervention to decrease fall risk, might have to go to a rehab facility and not be safe going home, or are limited to the house, short distances in the community, or in the community. So we measure this. I say on your mark, get set, go. Let's see. Oh, that's a little slow, or that's a little fast. And we work on that as a baseline. So when you're walking, I don't want you to think, ooh, here comes the curb. I gotta go slow. Here it comes. I want you to attack it. I want you to be confident. I want you to think slower is not helpful. I want you to go right onto it. Because we know that faster, not too fast, it should feel a little faster than you think you should go. Yeah.
Are you supposed to look forward or check the ground?
With good eyesight, you should be looking at the horizon, but still able to take in the environment. So I don't want this for sure. I want the head up in neutral and the eyes are gazing forward, but you're still always scanning what comes ahead. Now, if I was looking out and I saw, well, there's the curve, and now the curve's coming closer, I'm not going to do the curve blindly. I'm going to look at the curve, but ahead. Yeah, good
Kind of think
question.
about when you're driving, you're not looking 10 feet in front of you, you're looking out to see what's coming. So it's a similar thing when you're walking.
Yeah.
What are your thoughts on chair yoga?
chair yoga, a great way to get your body moving, a great way to exercise, but you're sitting. So in terms of making balance better, if it's hard enough to make you stronger, it's affecting balance somewhat. But if you don't use it, you lose it. If you don't practice those balance positions, it's probably not enough to make your balance better. It might be enough to keep it. But I would consider maybe doing a little of both, or asking your instructor, hey, can we do a little bit of standing at the end? And considering it's chair yoga, it will probably be modified and exactly what you guys need for the class. Yeah. Same thing, great way to work the quads and the hamstrings. There's just something different about being on the ground. Excellent way for heart and lungs, but it's just not the same strength as walking and as balance exercises. But again, in terms of heart health and general health, 150 minutes a week is the goal, and that counts. Okay, how should I walk? We see this walking sometimes all the time. I could tell you, well, I want you to go heel to toe with your head in neutral and your arm swing and the hip extends at about 30 degrees and da 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 da. I could go through all that. I'm going to give you 2 words, big steps. That's it. When you walk, you're going to think of Kate Campbell because she told me to walk with big steps. Big steps solves all the problems. It gets the hip moving the way it should. It automatically brings the posture up. I can't take big steps like this because it stretches my hamstrings so much. It's the right balance. It's the right posture. It's the right speed. Just think big steps. Yes? And tell someone who's struggling, it's okay. Take big steps. Take bigger steps, not these little ones. Okay? Doesn't that look like she's taking some good big
Even
steps
if you're
there?
using a walker or a cane, big steps are important. You don't want to have that walker and have little steps as well, so just keep that in mind.
Yes. Okay. Exercise. If you don't have an exercise program yet, I hope you're going to walk out the door knowing you need to start one. We gave you some things to do. That's a good place. Figure out, do I want to do this alone? Do I want to do this in a group? Find a class, whether it's chair yoga or another yoga or Tai Chi, to get it going. If you think this is not enough, you can always come to a physical therapist who will be more than happy to give you exercises that you can do. There's Founders Hall programs, rec center programs. Tai Chi is fabulous for balance because of the positions that it puts the body, the head rotation, the different poses. It's not just very straightforward. In fact, they've studied Tai Chi specifically, and it reduces fall risk 55%. Like me, get a buddy, stay accountable, push through for the first 2 weeks. It's new, you're doing something different on the calendar, put it on the calendar, and after 2 weeks, like you said, you start to miss it when you don't exercise, and that'll get your body accustomed to all that activity. You could do it on your own, you could go to the gym, you could use equipment, you could use bands, you could use body weight. Just get moving, whatever is easy, and you can implement.
Faster than a stroll.
A little faster than a stroll. You should feel like you have to
Doesn't
take,
want to walk faster.
get it, then that's for social, and then get another buddy.
Yes.
Okay, Gigi's gonna talk about those home safety things, because remember, falls happen in the home.
And I'm a little bit older than Kate, so I don't wear, I have nice sturdy shoes on, so I've got a couple decades on here. Okay, so where do people fall? These are just some statistics of 55% of seniors, they fall inside their homes. 23% fall outside, and 22 occur away from the home. And typically people fall in their home, 31% fall in the living room, because that's where we're doing most of our stuff. You would think it would be the bathroom or the kitchen, but 31% in the living room, 30% in the kitchen, and bathroom is 13%. So those are just some places where people fall. Some safety, some tips, just some quick things to do as we go up throughout the house. Your stairs and your steps. We want to make sure, I know I do it all the time because I've got 2 kids and they don't do anything, they don't clean up around the house, and I put stuff on the stairs saying that they're going to walk past this, right, and they're going to bring it up to their bedroom. That doesn't happen, right? Not a 17-year-old or a 13-year-old. But keep things off your stairs. Make sure they're clear. check to make sure that everything is, that you don't have any loose or uneven steps, that your rail is sturdy. It's very important to use a rail. If you are going, we want you to go up and down steps, so we want you to use that rail. We don't want you going up and down carrying groceries and all that kind of stuff. We want to make sure steps are just like the sit-to-stands. Steps are really good for strengthening, so we want you to use those steps, but make sure you're using the rail, that it's a nice sturdy rail. And lighting is so important on the steps. Just second railing, so it's really good to have that. Your floors, check your floors in your home. One of the first things we do as therapists when we walk in, and we do a safety, and we say, well, these slip rugs, we do recommend, especially if you're using a walker or cane, to get rid of those small area rugs, because they are tripping hazards. And if you do insist on having the rug, make sure that they have a binding down so they can kind of see.
Even bathrooms?
Even the bathroom rugs, I know that you want to have them as you get out of the shower. Make sure that it is a good one that has like a rubber bottom so it doesn't slip. Some of those bathroom rugs, they slide. So just make sure that it has a good, supported bottom on it, or a rubber bottom on it. Again, on your floors, clear all the cords, all that kind of stuff. All this stuff is, just kind of common, but that we see in people's homes. And again, night lights, it's worth the investment. The night lights now are, the nice LEDs that go on automatically at night. They're a little more expensive to buy at first, but they don't use any energy really worth the investment, especially in hallways and in bedrooms and all that kind of stuff. Kitchen. Why is it that we have our favorite pot on the top shelf, right? We're always reaching for that favorite pot, right? So we want to take that favorite pot and put it down at a more manageable level. So just kind of look around your kitchen where you typically, do things. So do that. Avoid using the step stool. Hopefully you've got that pot now at a normal level. And I always say to our patients, if you're going to do something and you say to yourself in your head, self, I probably shouldn't be doing this. Don't do it, right? Because that's when accidents happen. So avoid using that step stool. And then obviously if something spills, clean it up right away, because sometimes you get distracted and you forget about it, and then you tend to go and slip on it. In your bedroom, remember to have a light that's easily accessible. Clear the path if you have a bathroom that's right off the bedroom, or make sure it's nice and clear in the middle of the night. We do recommend, if you're having problems getting out of bed, it is these bed rails. This one's a full rail. There's actually a better one that's a little half rail. We recommend those. They make a huge difference with getting in and out of bed. This gives you that little bit of support. So, and they slip right on. These are the ones that are used, they're more secure, they're a lot more expensive. These are, they use me a lot of the assisted livings. So that's what that is. But just in general, if you're having that problem getting out of bed, the bed rail is important. And look at your bed. Make sure it's not too high. Sometimes your feet are dangling, you can't get in there. So, it's nice to have that like perfect height bed if you can. And soft beds are tough too, because you can tend to slide out of those, so just kind of watch that kind of stuff. In the bathroom, so non-slip mats in the shower, in the tub, grab bars. This is a picture, and I have a whole other lecture that I've done about doing beautiful bathrooms, because if you are looking to stay in your home, we want to make your bathroom safe. So you can do beautiful bathrooms that don't look institutional. Now they have beautiful nickel grab bars. They can go in, and so make sure that you're installing grab bars. It's really important. Have a shower chair. If you're in the bathroom and you feel like you just can't get through the whole shower, it's okay. Sit. Have a handheld shower wand is great. These are very easily installed. You just take off your original faucet and the screws right on, and it's really nice to have that. So those are the things that we look at as therapists when we come and kind of assess the house for safety, to make sure that everything is safe. And the toilets. Now they have the comfort height toilets. They're really nice as opposed to the old ones that are really low. So have a nice, making any sort of investment in your bathroom, if you update it nicely, you'll get your money back. So those are just some suggestions that we do. And then just in general, you know, when you're looking around your home, just look for the good lighting. Make sure your lighting is good. This is just another picture. You know, look outside your house. Make sure you have good railings, that they're sturdy and they don't need to be replaced. You know, this is the middle picture here is just another kind of shower bar. The bath, if you have a tub and you're having difficulty getting in and out of the tub, these are called the transfer benches where you kind of sit on it, you kind of scoot, and then that way you have a chair in the shower. This is just another kind of raised toilet seat, and these two are just different raised toilet seats. If you have a low toilet, you can get one with a little bit of height on it if you're having problems getting off of the toilet. The other thing you can do for many of us, medical alerts. So I don't know if you guys, you know, I've fallen and I can't get up. We at RVNAHealth, we use Lifeline. Statistics say that it's 67% mortality if you don't have a Lifeline, that your chances with a Lifeline, we can get to you. You will get some sort of attention within 22 seconds. So if you do fall, someone will call you. And they'll ask you if you're okay. So the Lifelines, having some sort of medical alert is really important for those, especially if you are living alone and you're fearful. I mean, we all think we're going to have our cell phones with us, but you know, if we fall, it gets thrown into you know, where you can't reach it. So we have 3 different options. This is a regular push button. That's an auto alert, and then there's a GPS one, which is actually really nice for you to wear in the community. And again, these life alerts are not just for falls. I tell the story of my grandmother years ago. She had one, and in the middle of the night, she was having a cardiac, you know, CHF where she was couldn't breathe, and she did not. She waited. She kept, you know, she was having about 2 o'clock. Finally, about 6:37, she calls my parents. I think I need to go to the hospital, I can't breathe. And I said, Grandma, well, why didn't you press your button? She's like, well, I hadn't fallen. And I said, it's not just for life, it's a medical alert. So there are good for those kind of things. So she thankfully was fine at that time, but she should have pressed her button at that.
Push comes to shove, if you need it, and you have an iPhone. You could
Yes.
ask Siri to call 911.
Yes, you can.
And they call right back.
Yes, you can. Absolutely, Sarah can do it. I'm sure Joy has the similar thing. But yes. But what's nice about these is that, you know, they'll call you and they'll say, hey, are you okay? You can say, oh yes, you know, or if they don't hear from you, they'll, and then they alert your whoever you have on your list.
Didn't they years ago have a situation where somebody called you every day and said, are you okay?
Are you okay? No, the town still has the Are You Okay? Yes.
The town has.
This town does have that. You can get on that list. And I think I remember recently there was an incident where they called the person and they didn't respond, and there was an issue that they were able to find that they needed medical help. Yeah, so yeah, I do believe we still have that Are You Okay list.
Yes, we do.
Yeah. All right, so that's kind of what we wanted to talk about. We wanted to talk a little bit about home safety and the balance. You guys, I know you guys are asking any other questions that we can help you with. We can do the checks of your cane and your walkers. We also have some of the non-slip socks. So again, what we talked about in your home, we've got nice non-slip socks for you, so you can grab those on the way out. And if you have any issues that you think you want someone to look at you more closely, like we mentioned, we have a center right here at 27 Governor Street. We can see you for up to 5 visits under direct access. We don't need your doctor. After 5 visits, then we send it to the doctor and he signs off on it. So if you're looking for a little bit more detailed, kind of a full assessment on your balance and all the strength, we can see you right here at RVNAHealth at our Rehabilitation Center.
Is there a way to deal with wet tiles in the bathroom? Because because.
Dry them.
Yeah.
Yeah, dry.
It's very difficult. So yes, use a shower mat and just make sure it's one that has a good grip on it, so when you get out, it doesn't
But
slide.
when you step off the
Yeah.
mat and you walk on the tiles,
Right.
sometimes there's moisture, sometimes there's.
Right.
And that's where it's most slippery.
Yeah,
Make sure you really dry your feet.
Oh, really dry.
And fan on
yeah,
when my husband is.
yeah, just try to really dry your feet as best you can. Or have, sometimes people have like shoes that they slip right into, that right as they get out of the shower, like the Crocs these days, they're easily slip on and you can slip right into those, and then they can help you on the travel.
They help
Do you recommend removing the throw rugs in the bathroom?
Keep one for as you get out, you need something
Because
there.
it has no place to put it, so it
Yeah.
has to be on the floor.
Yeah, so you gotta have something as you get out of the shower, just make sure it's something that has some sort of grippy on it, so it doesn't slide as you get out.
Thank you all.
Thank you.
Very